This is the Intraosseous Infusion skill. First thing we want to do is explain the procedure to our patient. From there, we're going to go ahead and assemble our equipment. For this skill, we will need IV solution, an administration set, our IO needles and insertion device, our sharps container, as well as tape, alcohol, gauze, syringes, and Curlex. You'll also need PPE consisting of gloves and eye protection. Now we're going to prepare to spike the bag. First, we want to grab our saline solution and make sure we have the proper solution with a good expiration date. We also want to make sure the solution is clear and there's no particulate matter. We're also going to make sure that the tail ports still have the protective coverings on them. Next, we want to make sure we have the correct administration set with the proper drip rating. We're going to remove it from the package, making sure it stays untangled, and make sure both ends still have the protective covers on the ports. Lastly, we want to make sure our flow clamp is close to our drip chamber. From here, we're going to remove the protective cap from the administration set, as well as the saline bag. While maintaining sterility, we were going to puncture the seal, turn our bag upright, squeeze our drip chamber, filling it halfway. From there, we're going to bleed and purge all air from the line. Once all air has been purged, we'll close the flow clamp, reattach the administration set to itself, hang our bag, and prepare for using the IO. Now we're going to prep the rest of our equipment for the IO puncture. First, we're going to prep the tape and our securing device. We're going to remove the Curlex from its packaging. And tape one side of each end together. From there, we're going to make sure we have our alcohol swabs, and we're going to make sure we have our appropriate PPE. We're now going to choose the appropriate anatomical site for the IO puncture, which in this instance will be inferior to the tibial tuberosity, right here. We're going to take our alcohol swab and clean the site in a circular motion moving outward using aseptic technique. Now that we've cleaned the site using aseptic technique, we're going to go ahead and choose the appropriate size needle for the IO insertion. We're going to use the pink pediatric needle. We're going to grab our insertion device, remove the needle from packaging, and we're going to inspect for burrs. After inspecting for burrs, we're going to stabilize the leg, making sure our hand is not underneath or near the puncture site. We're going to advance the needle at a 90-degree angle and make our puncture. Once the needle has entered the intermedullary canal, you will feel a pop and notice less resistance. From there, we will remove the insertion device, remove the needle from the catheter, and sharps the needle. After we've sharped the needle, we're going to attach the administration set to the line. From there, we'll attach a saline flush to the port and slowly inject while assessing for infiltration and aspirating to make sure that we have a patent line. From there, we will adjust the flow rate appropriately and stabilize the line. After securing the device, we will assess our patient for our therapeutic response as well as any adverse reactions.